the cricoid cartilage, which is posterior to that, and as you can see, it doesn't flex as much. It's much harder, thicker cartilage. The thyroid gland is going to be located on either side of the trachea. It's a little bit lower than where our thyroid is positioned. The other difference is its isthmus is posterior, where ours is anterior. So we have the two lobes of the thyroid gland, then the trachea. The trachea divide. This never got dissected out. To form the right and left primary bronchus. So again, you can hear the cartilage as I run across the bronchus. So the right primary bronchus entering the right lung, obviously the left primary bronchus entering the left lung. And you'll find those bronchi on the posterior side of the lungs. When we look at the lobes of the lung, the cat has 4 and 3. 4 on the right, 3 on the left. Anterior, middle, posterior. The fourth lobe from the right side is right directly underneath the heart, and that's the mediastinal or mediastinal lobe. So it's on top of the diaphragm, underneath the heart. So again, anterior, middle, posterior, mediastinal lobes of the right lung. Anterior, middle, posterior lobes of the left lung. Then the last respiratory structure, the diaphragm. When we get to the urinary system structures, the superiormost structure that you all are addressing is the adrenal gland, and the adrenal gland is superior to the kidneys, and it sits in the same fat pad, but it has its own capsule and is completely separate. The tissue is very similar to that of the pancreas. So we have the adrenal gland, then in this case the right adrenal gland, right kidney. If we clear away some of this fat, we can see the renal artery and renal vein. The vein is inferior and superficial on the ventral side, and obviously color-coded in blue. Exiting the kidney here, we have the tube of the ureter, and the ureter is going to take us down to the urinary bladder, and you can see that it enters in, the ureters enter in on the posterior side of the urinary bladder. Exiting from the anterior surface, inferiorly, is the urethra. So those are the urinary system structures from the cat. This is a female cat, so as we look for the reproductive structures, we're going to have the gonadal artery and vein, which also can be in the female referred to as ovarian artery and vein. On the right side, the vein enters directly into the inferior vena cava. On the left side, the gonadal vein enters first into the renal vein and then into, and this one's been broken off, and then into the inferior vena cava from that. The ovary, you can see, is the little knot here with its own blood vessels at the head of each area of the uterus. So the uterus in the cat is a two-horned uterus. And so when we do have the pregnant one in this class as well, that really, you can really see that the kittens will pouch up individually down the length of each horn of the uterus. Posterior to the urinary bladder here, where the uterus horns come together, we have the cervix. And so the cervix, two horns of the uterus, and then at the head of each horn, we have the ovaries.
Is there any, what would decipher, what side the kittens were on? Is it just space?
It's actually which side the oocyte came from.
Okay. So
and as they're fertilized.
on one side?
Potentially, yes, but typically the ovaries release multiple.
Okay.
Each ovary will, in a cat, release multiple oocytes.
Okay.
So our ovarian, you can see here that big broad sheet ligament. Actually, I don't think that's not on the study guide. So with the male structures, you would be doing the gonadal vessels, the penis and testes, and the penis and testes obviously are going to be external structures for the male. Does that get us all our systems?
Mm-hmm.
Let me see. Nose, pharynx, larynx, trachea, hard palate, cricoid cartilage, thyroid cartilage,